Sagging of the tissues in this 55-year-old patient has brought about a loss of the relief on the cheeks and the appearance of pronounced nasolabial folds. To alleviate the effects of this sagging, we will re-inject some volume at the level of the maxillary bone through a single point of entry. The alignment of the axis of the tear-through on the one hand from the line connecting the upper part of the tragus to the corner of the mouth on the other hand, and from a line between the outer orbit and the corner of the mouth, finally enables us to determine the location of the point of entry to make the injections by means of a cannula. Modulus gel, known for its extremely volumizing and malleable qualities, is what we will inject via the Antius automated injection system. As with any treatment performed with a cannula, we first create a small opening with a needle of the same diameter as that of the cannula. Slight pressure allows us to easily identify the opening that was created and to introduce the cannula at a deep plane without any difficulty. This is inserted in its entire length into the tissues in the direction of the tear-through. Check by palpation to see that its positioning is correct. Begin the continuous injection according to the retrotracing technique. Constantly check on the proper distribution of the gel with your free hand. When the cannula almost entirely comes out from the tissue, change the directional angle slightly and repeat the injection so as to cover the entire area of the anterior maxilla, according to the so-called fan method. The flexibility of the use of the Antius injection system, which ensures a continuous flow and a constant ejection speed, allows you to focus on directional changes and on the placement of the product while remaining perfectly free in your movements. In the case of a skeletal aspect of the face, it is finally recommended to deposit the gel in the pretragal region to harmonize the periphery of the cheekbone. 1 milliliter of Modulus is sufficient to restore a well-balanced volume to the cheek and to blur the effects of ptosis at the level of the nasolabial folds.